So nice to meet you. I know that you are, a big part of the Sava Clinics team. I would like to know a little bit more, what is the nutrition's job actually in the weight loss surgery, pre or after? There is two parts of this.
Yeah, I'm actually working everywhere, like sometimes behind the camera, sometimes front the camera. So sometimes patients know me by the post-op, sometimes they know me in the hospitalization time, but generally I'm in the organization part, but also in the diet part.
Amazing.
So nutrition in bariatric surgery is very important. We are doing very tedious job here in a nutrition follow-up, because people think that bariatric surgery or weight loss surgeries by itself is a medical solution, but it's not by itself. It's just a tool
It's
that
a
they
tool.
can reach.
Help them, yes, to reach their goal.
Exactly, to their dream.
Yeah.
Because everyone has a dream that they want to reach, but using this tool in a right way is a responsibility of sometimes persons. But to teach them how to use this tool, we are here.
That's your job, exactly.
Yes, exactly. So, and by using this tool, they can have a chance. To reach their goal in a healthy way. Because after bariatric surgery, with losing the part of the capacity of stomach, they will be able to follow a diet somehow. But how they follow matters. By reducing the fats that they have or replacing with the healthy ones, and increasing the protein amount and reducing the high carbohydrate amount. So by this, as a nutritionist, we try to make them lose by protecting their muscle and protecting their immune system, because sometimes they may have like diseases since they lose so fast
weight. Your immune system is slightly down, so you want to protect that, right?
Exactly.
And build it up again.
No matter which age you are, when you have a mom and when they learn that you have surgery, they tell always like, hey, you're gonna get sick, don't have surgery, like you're gonna lose your health. So no, actually every day with obesity is a risk for your health. Like sleeping and waking up again with this high weight, you put so much stress on your organs, your joints. So that's why it's very important to do one change in your life to have it like fully change. And also, yes, we have a follow-up after surgery, but also we start to follow our patients even before, because depending on their BMI, we need to make patients like ready, but for the type of obesities like morbid one or super uber, so we need to follow a diet where we reduce again the carbohydrates, but also make them mentally ready. For the changes. So even though we change some rules in our diet, we again make them ready for the first month's diet, as like Sophia mentioned to you. So they're gonna be so like strict rules for the first month.
For the first month, yeah.
But when you have the change like this, it's so hard to do like adaptation. So we're gonna have a diet with our like follow-up team. And depending on their BMI, we put them in a progress like schedule. Sometimes 2 weeks diet, sometimes 1 month, sometimes 2 months. For example, for the BMI of 60, this is very huge and
this is very risky.
Yeah, because you see some fat around their body, but also there are so many fats
inside.
Exactly, surrounded with the organs. So which creates the risk for the doctors to perform the surgery. Because when they think that gastric sleeve has low risk, but for doctors this makes very huge
difference
to reach the stomach while there are so many fats in the cavity of the abdomen. So that's why it's very important. Has a big role of the patient's life, because you become not just a nutritionist of their life, since they maybe visit so many dietitians while they're trying to lose weight. So many papers, so many weight loss.
The surgery probably, when they come to that point, they probably for years been going through so many different things.
So we also even call that as a yo-yo effect, when they lose and gain and lose and gain. So to become a dietitian in weight loss surgeries, you also have to be there like sometimes psychologists, sometimes they're friends,
Of course.
sometimes they're like partner, everything.
I mean, we all know
family.
like mood swings when it comes to food, and when you're
Exactly.
hungry and when you're not feeling well. So obviously that is normal. You might see this quite a lot. Yeah.
Before they say it, we have to understand what they mean,
Yeah.
actually. And I tell them always, like, I got you, always. So, and sometimes they even tell us, like, hey, I was just thinking about something to cheat and you texted me. Do you see me like this? We have this sense, like
Yes, of
magical
course.
sense between our patients, because, as Sarah told you, we create very soft bonding and emotional bonding with them. So even after like years and years, I don't know how many years I'm working in this job, maybe 7 years, but still I know each of them, and I still talk with them. Like, they call me when they come here, Turkey, hey Rachel, can we have a coffee? Can we have like a dessert or something like that? They still do it.
It's a very emotional, and it creates that kind of personal bond, and I think that's very special.
Just think about you. So you decide to have something, and you come here, and after you left the country, you will be in touch with someone who is talking you with the WhatsApp. It's like a robot, right? And since technology has like growing a lot, there are like ChatGPTs or something like that. So many intelligent things. So it makes you more like feel a robot. Not to make them feel like robots, you also need to share some things from your perspective, your life.
Yeah.
They even know things about us as well. I tell them like, hey, I went to this place. Hey, just share with them like random pictures, videos, to make this connection, because they have to know that you're a regular person.
No, of course, but I think it was the Sava Clinic look at their patients. You know, you become a part of the family.
Yeah, maybe it's like cliche to say like we are family, but we are definitely family.
You know, who's working together. It is actually magic. You do actually have that very special bond and touch.
I hope we also make you feel like you are a part of family from now too.
Thank you, and you've definitely done that. It's been such a nice time being here. All of you are very passionate about your job. You know, this is different. Some people might be very talented in something or educated, but every single one of you at Sava, actually, you're very passionate about what you do, very committed to your job.